Hello and welcome. Did you know that women are 8 to 10 times more likely to suffer from any thyroid related disorder as compared to men? In about 42 million people roughly in India suffering from thyroid related disorders, that makes about 38 to 39 million females, most of whom may not even know what they're suffering from. What is thyroid? Well, thyroid is a gland. It's present in your neck, and in females mostly it's not visible. It releases two very important hormones, T3 and T4, and these two hormones basically work on each and every cell of your body. What they do is basically dictate how good of a metabolism you're going to have, how fast or slow it's going to be, therefore dictating each cell's growth, its normal function, and just a general well-being of each and every cell in the body, and that means each and every system of your body. We doctors like to usually classify thyroid disorders in two broad categories. One is hypothyroidism related and two is hyperthyroidism related. When we talk about hypothyroidism, we are generally talking about hormone levels which are lower than normal levels. When we talk about hyperthyroidism related, we're talking about levels which are higher, hormone levels which are higher than they normally should be. In accordance, the difference between the two will lie in the symptoms and what's internally happening as well. So quickly getting into hypothyroidism, what it means is that there is lower levels of T3 and T4 in the body. Therefore, everything is low, everything is slow, the metabolism is slow, the utilization of energy is slow or inadequate, and there's low stimulation. So everything is in underdrive, almost stationary, you can say. So everything, when it is slow, you can expect a female with hypothyroidism will feel a lot of fatigue, and the reason for this will be inadequate utilization of energy which is available. Number two, she's going to feel like she's gaining a lot of weight despite eating normal or even a restricted diet. Women with hypothyroidism can experience constipation because everything is slowing down. Their speech, they'll feel it is slowing down, sometimes even slurring. Their skin will feel really dry and rough. Females with hypothyroidism can feel very low and their mood may be depressed. And this is because the hormones are not acting or not being secreted in an adequate amount. In terms of reproductive health, women with hypothyroidism at a pre-menstruation stage can experience delay in puberty. During the menstruation or reproductive age, they can see that their periods will start coming farther and farther apart. They will also experience issues with their fertility, and that may be because of the thyroid hormones affecting your reproductive hormones. Jumping to the hyperthyroidism, this is completely opposite. This is where there is an excess production of the hormone levels, so there is too much T3 and T4 being secreted, and everything is in overdrive. Everything is being overstimulated, everything is going fast. That's how we like to think of it. So in terms of symptoms, a lady with hyperthyroidism is also going to be feeling fatigue, but the reason for this fatigue is actually going to be a very quick utilization of energy, as opposed to hypothyroidism where they were not able to utilize the energy that was given to them by their food. They will feel like despite eating a lot of proper meals or even eating in excess, they tend to lose weight and they're not able to hold on to the weight that they usually prior to had. Patient with hypothyroidism will feel much warmer compared to people around her. You can always find them by asking, it's really hot in here, and everybody else will tell them, no, it's not, it's actually pretty mild. They will experience increased frequency of passing stools. Like I said, everything is going in an overdrive. And when it comes to their mental situation, they feel very irritable. They feel very nervous, jittery almost, because even their brain, the hormones controlling their brain, everything is happening in a much faster manner. When we talk about reproductive health in hyperthyroidism patients, especially in female, generally they will also experience infertility. What they will see is their menstruation will start coming more frequently. So very opposite to hypothyroidism, they will find themselves menstruating maybe more than once a month. and therefore that also is a type of dysregulation to reproductive hormones, causing infertility or difficulty in achieving or conceiving. People with hyperthyroidism, females with hyperthyroidism, can also go in for early menopause at around 40s. Sometimes they may develop symptoms that mimic very closely of menopause, but they may not actually be going through menopause. Now, this is how we broadly look at thyroid disorders. When we talk about a type of symptom, the diseases in it, the diseases causing these symptoms can be very, very different. When we talk about hypothyroidism, the treatment options are pretty basic and simple. Because there's lack of hormones, we should supplement you with hormones. We have synthetic version of the thyroid hormones, which you can take by mouth every morning before you eat anything. When we talk about hyperthyroidism, it becomes a little tricky. There are options, there are of course medicines available. There's also the option of surgery or radioiodine therapy, but it almost always is going to depend upon what is the cause of hyperthyroidism, why is the woman experiencing this, and what could be the issue in the thyroid itself. As always, I say, please make sure that you're not ignoring your symptoms and you are seeking the correct help and timely help. In any case, if you have any comments, any questions that you'd like us to answer, please do not hesitate to put them down. We will get back to you, and I hope you guys are all staying safe and taking good care of yourselves. Take care. Thank you.